My name is Deanna Rodriguez. I'm a veterinarian at Manlius Veterinary Hospital. And this evening's lecture is going to focus on how to keep your pet moving with animal chiropractic. Okay? Now, for those that are not familiar with chiropractic care in your pets, I'm hoping that this lecture is going to be informative. Okay? We're going to just briefly talk about the history, how it came about, what is chiropractic, what are subluxations and how are they treated, common causes for subluxations in our pets. We're also going to show you some of the symptoms, help you identify some of the symptoms that you may see in your pet that would indicate that they would benefit from some chiropractic care. And finally, we're going to end with an actual demonstration. So I'm going to walk you through a typical chiropractic appointment, and that's going to happen with the assistance of my dear friend Pudge, who's sleeping right now, and his mom, Carrie. Okay? So chiropractic comes from a Greek word meaning to perform with hands. It's a manual therapy. It started over 5,000 years ago. The developer of modern-day chiropractic is this eccentric gentleman here named D.D. Palmer. Now, D.D. Palmer developed the theory that misalignments of the bones within the body would cause dis-ease within the body. Not disease, dis-ease. So something is throwing off what's considered normal in the body. Okay? He also thought that these misalignments were most commonly found within the spinal column. Okay? So he had a theory. He just needed to find a guinea pig. And late one night, he was working in the basement of his building, and this loud fire truck came round the corner, and he got so scared, he jumped out of his seat, and he looked over at this guy, who was the custodian of the building. His name is Harvey Lillard. And Harvey was acting like nothing happened. He didn't even flinch at the sound of the noise. So Palmer found that kind of interesting and struck up a conversation with Lillard and found out that Lillard was deaf. Much to his surprise, Lillard was born with normal hearing. He became deaf later in life. Lillard bent down to pick something up from the floor, and when he stood up, he felt a pop in his back, and then after that, he was deaf. Okay? So Palmer was like, this is the best time right now. He felt the pop, he went deaf, this is the best place, I can use my skills. So he convinced Lillard, hey, do you mind if I feel your back? Lillard said yes, and as he was working down Lillard's back, he found a spot in between his shoulder blades, and he just put in a little bit of force there, and almost immediately Harvey Lillard's hearing returned. Okay? So word got out pretty quick of the miracle that Palmer performed, and next thing you know, patients are lining up around outside his building, wanting to be seen for every possible symptom they had: headache, stomach ache, flu-like symptoms, seizures, heart problems, and thus became chiropractic. So in 1895, we had the first chiropractic college in the United States, and it took a long time, a lot of time, but starting in the 1980s, there was the thought, well, if people can benefit from chiropractic care, then why can't our pets? So in 1982, we had the first postgraduate program for animal chiropractic. It was founded in Iowa, USA. Currently, there are 3 animal chiropractic colleges in the United States, and there are 2 in Germany. So chiropractic focuses on maintaining the health of spine, the bones, musculoskeletal system, and the nerves. Now, why do you think it's important to maintain the health of the nerves within our body? Exactly. They control everything that happens within us. Without our nervous system, we wouldn't be very smart. We wouldn't be doing everything that we do. So nerves control everything within the body. Now, contrary to traditional veterinary medicine, where it's allopathic care, so you see a symptom, you treat a symptom, chiropractic is vitalistic care. So we focus on the animal as a whole, not as separate parts, not as a leg, not as a head, not as a upper respiratory infection. It's everything. And there's a thought that every animal, every being is born with what is called an innate intelligence. All right? It is this innate intelligence that gives us the ability to function. Our health is a reflection of this intelligence that we're given with, that we're born with. So what in our body gives us this intelligence? It's our nervous system. And the command centers of the nervous system are the brain and the spinal cord. And those are protected by the skull and the spine. So you can see how maintaining a healthy spine can help maintain, thank you, Pudge, can help maintain a healthy nervous system. All right? And for those that need to visualize it, this is the vertebral column of a dog. This is the spinal column of a dog. This is your spinal cord coming out right here, and all these little pieces right here are nerve roots. And they're conveniently wedged between two vertebrae. So we can see how if one part of this spinal column doesn't work, what's going to happen? You're going to pinch or you're going to stress the nerve in that area. Is there a question? Okay, I thought. Oh, you're counting. Yes, there's a lot. Depending on the species, the amount of vertebrae you have change. Yeah. So. Right, so in a dog it's C7. So you have 6, you have 7 upper cervical. All right, you have 13 thoracic, 13 here. You have 7 lumbar here, 3 sacral, 3 to 5 sacral. Dog. I don't know, people. I get asked that question a lot. Hey, Doc, can you help me too? No, I can't. I'm sorry. And there's about 20 different vertebrae in the tail itself. Depending on the breed, it may be less than that. Okay? So when you have an area of the spine that's not moving well, so an area of vertebra that's not moving as well as it can move, you have what's called a vertebral subluxation complex. Now that's the medical chiropractic term. For lack of a better word, I'm going to call it stuckage. Okay? And when you have a change in motion, that has a rollover effect on the rest of the body. So you have a change in motion, and what happens? That puts stress on the nerve that's coming out in that area. When the nerve is stressed, it can't communicate well with each other. They can't. If they can't deliver a message to each other, how do we expect them to deliver a message to muscle? Muscles get altered messages. They're either told to be in spasm all the time, or they're told to not be used at all, which is where you get muscle wasting or muscle atrophy. And muscles aren't being used appropriately. Okay. The actual tissue of the muscle changes. Like we get what's called connective tissue that settles in. And connective tissue does not have the same properties as regular muscle tissue. All right, so now we're taking a muscle that's very spasmed or a muscle that's not moving, and now I'm taking away its ability to even perform that action of contraction. And when a muscle's not being used well, what happens? Blood flow changes. Things either get very hot, which is why if anyone's had a Charlie horse, you can just feel that area and it's just hot. Or we get no blood flow to that area at all. Now, for those that are visual learners, this is the norm. Let's assume my finger is a vertebra. Okay, this is the normal range of motion of this vertebra. Now I'm going to go ahead and I'm going to restrict the movement of this vertebra here by using a Band-Aid, rubber band. I can't bring this back to here like it was before. I'm not sure if anyone can see, but my finger's also turning purple. Okay? So what did I do right there? I changed movement, which has changed messages to these muscles, so I can't bring this back, which has changed blood flow. All right, so that's just a nice way to actually visualize this odd diagram. Now, what do people tend to do? People like to put ice on it or heat on it. That's going to make you feel better, but what's still there? That lack of movement. All right? And the way we get the spine to actually move in the right direction is what's called an adjustment. So an adjustment is going to take away that rubber band that was constricting my finger. An adjustment is a very specific, high velocity, low amplitude thrust in the direction in which the vertebra doesn't want to move. Okay, so if I have a vertebra and it's like this when it really should go like this, I'm going to make it go that way. So my adjustment's going to go this way. An adjustment doesn't look like this, okay? So someone yanking on the tail back here is not specific at all. And there's nerves that go all the way down there. And just pulling a tail is going to cause harm. That's not specific. An adjustment is not this either. We do not use heavy mallets or anything of the sort. It's not forceful. It's very specific. It's just a little flick of the muscle. That's all it looks like. An adjustment does look like this. This is a dog who has an area of his upper vertebrae that's not moving well. She is on top of that vertebrae that's not moving. She's supporting the bottom of that dog, making him stable, and then she's going to go ahead and do an adjustment. This dog is liking it. He's like asleep. This is the very rambunctious Labrador Retriever that you're trying to do an adjustment on, but this dog is receiving an adjustment here to the lower part of his neck. This is not the biggest Dalmatian you've seen. It's actually a horse. And so this horse, the head's facing this way. So this is the butt end of the horse. Okay? This is actually, he's right on the hip. So he's working on what's called the sacropelvic joint. All right? And he's just going to do a thrust down. So this horse's hip is actually not wanting to go in the down position, so he's making it go down. This is working on a horse neck. This is perhaps the hardest adjustment for me because I lack vertical capabilities, but this is a horse that has an issue with its upper cervical vertebra. It's actually pushed up, and so we're trying to get it to go down in its normal movement. So we talked about just what adjustments look like, but what can happen in our pet's life that would cause these stuckages or these subluxations? And trauma is a big one. So what happens with trauma? Let's say we tore a dew claw, okay? We're not going to bear weight on that foot, all right? We're going to limp on it. We're going to baby it. We're going to get swollen. We're going to lick it, get a secondary infection. You go to the doctor, what does the doctor do? We put a cast on it, or we bandage it up, which then they act crazy because they don't know what a bandage is, right? So just that issue of trauma, I'm changing the movement. I'm making this animal bear more weight on this side of its body. I'm asking its spine to almost rotate to compensate for what's damaged on the other side. Conformation. Does anyone own a dachshund or a basset or anything? Nope. A corgi, there you go. So conformation, you guys know about conformation, but right here, this dog's back, the spine goes here, here, here. Right here and right here. Can you see how those are two big, high stressful points for this dog's back? That's often where we have issues in these breeds. We also have a point right here in the back, which is called the anticlinal area, and that's the most mobile part of the whole spine, and they also get an issue right here. So stress from here and here, these breeds get disc disease. And what is right above that disc, if it ever pops? Your spinal cord. That's direct input to stress on nervous system. This is the cat version of a dachshund. It's called a munchkin cat. That is it. That's all the legs it has. You can't stretch that out anymore, okay? It was a mistake that became a cute mistake, and so now we have many munchkins out there. But for those that didn't know that you can have one, that's what they look like. They also have this disease too, okay, and issues with their elbows. This is a German Shepherd. The normal conformation of a German Shepherd is to have straight legs. This is almost like a Corgi or Basset leg, okay, on a dog that shouldn't have this. So anatomy's wrong on this dog. Conformation is wrong on this dog. Am I going to expect this German Shepherd to walk just as nicely as a regular German Shepherd? No, because we have angles that are all going to affect the spine. Conformation is body build, is what I'm using it for, the body type. So this is a chondroplastic dog, same thing, chondroplastic. This is chondroplastic, and chondroplastic is just, they got the short, stubby, curved legs, right? So their conformation's a little off, but considered standard for them. It's the way they're put together. That's how I'm using the word conformation. Performance. So performance, does anyone have agility animals? Anyone compete? Used to? Okay. So what am I asking this dog to do? I'm asking this dog to be almost like a snake, right? This dog has to have the best back ever in order to weave between these poles within a matter of seconds. All right? So if we have a dog that's just a little off, you know it for anyone who's ever done an agility or performance. They know, gee, something's off. I know this animal can complete this in a couple of seconds. Why is it taking half a second more? So it's important that this back be in communication with each other. Environment. Kitty cats, I don't know why, but they have the necessity to protect us, investigate everything that comes into the household. So that involves sleeping and things that are very uncomfortable. This is more on the funny side of things, but how many animals are out there that are not appropriately kenneled or do not have appropriate housing, right? So if I'm sticking a 150-pound Great Dane in a medium-sized cage, this dog is eventually going to find out, well, I always have to turn this way in order to fit in this, right? So you're going to start seeing trends in those dogs that are in too small of an environment, or cats, same thing, if they choose to always sleep in a box. Weight. There is no reason why your kitty cat should fit in your toddler's clothing. But this one's more of an obvious because I am physically adding a good 6 inches of fat around that spine. So this spine is in a restrictive fat jacket. And that's something that we can work on. We can get them to lose weight to have that spine move a little bit better. But in the dogs that we can't, or we haven't tried enough, or their mobility isn't great to begin with, we need to help them move better in order to help them lose the weight so we can help that. You know, it's almost like going back and forth, helping each other. Age is a big one. This is a 21-year-old kitty cat. The cat looks his age, and we all feel that. I mean, you wake up in the morning and some days you feel fantastic and some days you're like, oh, wait a second, let me lay back down again. And that's another reason for why we can get desubluxation, just the normal aging process, arthritis that is settling in, that's not allowing us to move as well as we used to. So some of the symptoms, now this is a very important part because then you're going to go home and you're going to look at your own pet and tell me if you see anything. But an obvious one is change in posture, okay? And this one is a good beginner's example, but this is a good sit. If I ever ask a dog to sit, butt and knees should be almost in connection with each other. This is a terrible sit. All right, this is what's called puppy sitting. If you have a puppy, this sitting is normal until about 6 months of age. After that, it's considered abnormal. This sit, to me, means two things. Either this dog's hips hurt, so this dog physically can't tuck its pelvis into this position, or its knees hurt. So I can do this, but I can't really do this. So I just decide to kick them off to the side. So change in posture is one. Change in gait is another. I'm not sure if anyone has really observed their veterinarian do what's called a neurologic exam, but hey, Pudge, come here. But when I ask Pudge to, I'm going to flip Pudge's foot down like this. Pudge should realize his foot is not right and fix it quickly. Okay? There are some dogs where I do that, and they just stay with their foot like this. Okay? Or there's some dogs that come in and do this with their back legs. So they're walking and their back legs cross. Okay? While they're walking or when they're standing and they're like this. Okay? That is an obvious miscommunication in all manners between your back and your legs. Okay? The nerves here should tell your back or your spinal cord, hey, I'm in the wrong position, fix me. And your spinal cord should say to those muscles, fix that. And if we're not doing that, somewhere, whether it's here or whether it's here, we're not communicating well. Difficulty standing or climbing the stairs. And they could be, some dogs will go up the stairs fine, but don't ask them to come down the stairs. Vice versa. Some will, do one but not the other. And depending on what they do gives me an idea of, is it more a neck issue or is it more a hip issue, depending on the direction in which they go down. But if you physically see your dog thinking, or your cat thinking whether they want to jump on the table or whether they want to go outside to go potty, they shouldn't really be thinking. They should just do it. They're physically going, if I go outside, I may have to pay for it the next 2 hours because of the discomfort I'm going to be in. All right? Muscle atrophy. I'm not sure if you noticed, but the top of this dog's head is supposed to have two nice little muscle bellies here, and they're flat this way. What did I say about what happens with muscles? When they don't get a good signal, they either spasm or they're not being used at all. And this is what happens when muscles are not used at all. They sink in, they go away. Go ahead. So, for instance, I used a dachshund, but Labradors, certain German Shepherds, depending on the origin of the German Shepherd, but there's some really German Shepherds that are very slinky on the back. Okay, those conformations where they're very slinky on the back, they actually have a lot of lumbosacral, so down here issues. Labradors are notorious for not having great hips. Okay, that you actually, there you go, hips. All right. So Labradors, that they're born already with something that's not working well. This is an excellent hip. This head of this femur is fitting nicely inside the socket. This dog is going to move like it was supposed to move and move well. This dog, the head is no longer round. The cup in which it fits in is kind of flattened out. The hips aren't seated as nicely. You can almost see that there's that much distance versus in the other joint where there's not as much. So this dog is already set up for failure. That's the bad way to say it, but this dog is already set up to not move well. So I know that this dog, by the age of 4, is probably going to start showing some signs of lameness or not running or not jumping, or if they are running, they're doing what's called bunny hopping. So not running like this, but running by kicking their back legs. Okay? So yes, that goes back to conformation. So dogs that already have a history of hip issues, I say don't even wait till we see those issues. Come in, let's start getting looked at. Because if I can start feeling problems along the spine, we can work on them now and try to push farther out that arthritis that you're going to get, versus if you wait till we're 40 years old and then we don't do anything. Some breeds do. Some breeds do, not all. If you're going a really, really fast speed, yes. If you're just doing like a trot, you shouldn't really be butt kicking. Okay? Okay? Mm-hmm. Mm-hmm. Right. It doesn't necessarily have to look hip. The good thing about the spine, I almost think of it as the spine is so connected that we may not have directly an issue in the hip, right? Let's back up. I can have an issue movement-wise in the skull and have it present as a lameness in the back leg. Does that make sense? Because everything here is just connected to each other. And so with one adjustment here, I may be able to fix this lameness in the back. Now there are some animals, particularly horses. Horses are great at compensating. So if I go ahead and do an adjustment, which is why I don't like performing adjustments on horses right before a big show or any competition, but I can go ahead and adjust this horse and makes this horse spine move well, and its legs are just all over the place now. Because this horse was walking fine because it managed to compensate for its issues in its feet. And now that I've removed every compensation it has in its back, I'm starting to see the problem with the feet. Does that make sense? Did you guys get that? So that's why I don't like to typically adjust horses or dogs before a big event, at least not the first adjustment, because I don't know if I'm going to remove some of that animal's compensations. And what I don't want to do is for someone to show up at a show, I adjust, and now the animal is not doing well because I found, its toe hurts, and then I throw them off. Agility. Other indications that people don't really think of, vomiting and diarrhea is a big one. And there's a whole slew of other things that can cause vomiting and diarrhea. So this is generally your last resort is what I use it as. But all the nerves that go to the stomach and the intestinal tract are coming out of your spinal cord. So if we have just a constant irritated nerve, an adjustment within the thoracolumbar, so this area right here, can help. Incontinence. The nerves that are going to the bladder are coming out from this area back here. So sometimes we have arthritis in that area that interferes with us being able to hold the urine. So that's why we address this area. Seizures is one. Chiropractic is in no way to be the primary modality for treating seizures. You always want to go with your anticonvulsant medications. But I always say add chiropractic in there because sometimes changes in this area here, for instance, the skull and how it's seated on the upper vertebra or the upper vertebra on the second vertebra, can cause enough pressure changes within the head itself that can lead to or have an effect on seizures. So with seizure dogs or seizure cats, I always say go on your anticonvulsant medications, and once we're better controlled there, okay, let's start evaluating here. Let's see what we can do here. And once we've addressed the lack of movement in the upper neck, then we can slowly bring down those seizure medications. Exactly. Oh, he can't put on much to get or a couple of ounces make him look, yeah. Right. Right. Off to the side. Is he on the loading period, or have you been on medications for a while? So that's something that it could be medication related too, because phenobarbital can have that slight drunken sailor feeling to some dogs, but it's I always say stay with your meds and then try to add this in there. Now, the scary part of that is the changes that I'm doing in this upper area are so dramatic that I can actually cause a seizure as I'm doing it. So for my seizure patients, I always say, I don't know if we're going to have a seizure or not, because it's possible, but we're doing something to help address this issue here. So it's a way to add to support them a little bit better and hopefully try to decrease the medications. Particularly phenobarbital can have an effect on the liver, so you try to not want to be on that medication long term, so you try to get it to the lowest effective dose. Not a one-time seizure. Not a one-time seizure. We're talking about dogs just like in his condition that have idiopathic epilepsy, where we don't know the exact cause, but they have a seizure once a month, twice a month. So that he's not bad. But there are some dogs where they're on 3 seizure medications, and you'll be happy if you can get it down to 1 seizure a week. All right, so those are the dogs where I think that this would help them. Okay, so the goal of chiropractic care is you want to take those stuck parts, you want to put them back into motion to relieve the stress on the nerves. In doing that, you do a couple of things. You help reduce pain, you relieve the symptoms, you allow them to function better, and when they're functioning better, they can heal. All right, and it's when you have a normal, healthy system that you can start healing from within. We decrease the frequency, or we try to decrease the frequency in which certain conditions can occur, and we also try to prevent. That's the big thing, prevent any degeneration, so any arthritis, any muscle issue that can happen later on in life. All right? So any questions? I know everyone's been asking questions throughout, but does anyone have any more? It depends on the dog and the cat. I generally start off with, we evaluate now, and I see you in 2 weeks. I evaluate again in 2 weeks. If in 2 weeks we're doing better, fantastic. Next time I'd probably like to see you would be in about 6 to 8 weeks from now. If in 6 to 8 weeks we're doing pretty dandy, and as I'm feeling the back, I'm not feeling many changes at all, then I say, I apologize. Then I say, come back when you start seeing that we're heading a little down. Then there's some dogs I can't even get to the 6 to 8 weeks mark. They tell me, hey doc, by week 4, we're out. Come on in. Okay? Yes. Adjustments can get unadjusted by all those things that I said. And by sometimes, if I'm seeing, particularly in an agility dog, if I'm seeing a trend in the adjustments, in what I have to fix, this dog's hip is always facing this way. This dog's vertebra is always facing this way. And it's always this same pattern. What are we doing at home? What exercises are we doing at home that we can change? For instance, I have one case where I kept on seeing the same pattern in this dog. And I'm like, what are we doing differently? What are we doing that's the same, that is always giving me the dog always went into the car through the same door. And always came out the same door. So I said, mix it up a little bit. Do half, change that. And the next time I saw him, that trend wasn't there. So our normal routines that we get into, that kind of gets into the same routine too. Okay, so this is the portion where I'm going to ask for Pudge's help. Pudge and Carrie. All right, I'm going to turn on the lights for a second. All right. Ready? You ready? Okay. So a typical chiropractic appointment. Oh, wait a second. Not yet. I'm going to have them run around.
Oh, we're going to walk first.
So there's a lot that I do hands off of the animal first that gives me an idea of what's going on. Now, Pudge is 4 years old. He is overall a very happy dog. He will take sharp corners, and so we're hoping that his knees are going to be healthy. Aside from that, he has a history of allergies. That's it. He goes like that. But that is it. He has no other medical or orthopedic issues. So the first thing I ask for Pudge to do is walk towards me and away from me. Okay? And a couple of things I'm looking at when he does this is I'm looking at how does he carry his head. Does he carry it like he should, which is up here or down here or down here, and that is all breed dependent. I'm also looking at his legs in relation to his head movement. Some dogs with really bad shoulder pain or bad elbow pain, you'll see that as they put that bad foot down, that head will go up. When they take the bad foot away, the head goes down. So a limping dog kind of looks like this, right? It also gives me an idea of how we are neurologically. I don't want to hear any scuffing of his feet on the floor. I want to look at how he's walking. Is he walking legs in front, elbows out? How's he walking? So I generally ask for them to walk towards me and away from me. Come here. Okay. Go away. Run away. Come back. So he lowers his head, not because he's uncomfortable, just because that's his way of greeting me. But you see what he's doing with his back legs? That, in a normal walk, he shouldn't be doing. So I'm going to have her run. You see? He's hopping, and this is not fast enough for speed for him to be hopping. Okay, so he's off back here. All right. Thank you, Pudge. Okay, no, thank you. We're done with your rocking and running part. Up, up. Up, up. Thank you. So then the next thing I do is I actually start moving his joints in different directions to see, all right, what's the normal range of motion can I get from here? His head should go to about here. When I bring it down, his nose should touch the point of his chest. When I move him to the side, his nose should touch either side. Okay? And some dogs you can't even get that from. So he's already telling me no thank you. That's fine. So towards the end of that, dogs. Cats should do the same thing. So he doesn't really like any of that. And he's worse on this side than he is going this way. Okay, so I know up here we have something going on. Up, up. Okay. He's only 4. So he's a pit bull. Yep.
Pit mix. They're almost all pit mix.
So then I go ahead and I do hips here. I generally want to bring this leg out. Dogs, if I pick up his hips, both of his hips, let's see if he'll let me do it. No. But he should almost look like he's flying. I should technically get these hips up to about here. All right? Now, the reason he's not letting me do it is he's a little nervous. He doesn't appreciate me doing that. But he should be able to lift them all the way here. I feel knees. And a dog that has a ruptured ligament in the knee, ACL, will have a fat knee, for lack of a better word. So I'd feel swelling around the ligament here, and we'd have some, almost like a thicker tissue on the inner part of the knee. And when I pick this up, I will literally feel crunchiness, for lack of a better word. Okay? And his knees don't feel so bad, so I'm assuming it's primarily hip. Then I do my neurologic test. Right? He does well there. Does well there. This is kind of hard if you have an animal heart that really hates being trimmed, because they won't let you trim their feet at all. Fine. But neurologically, he's fine. I suspect we have an issue here, because this down here fell. And we have issues going on in the neck as well. Okay? When I look at muscle mass, too, sometimes a dog that's had an ACL tear, you'll see that the muscle mass here is significantly less than the muscle mass than good left. All right? So just doing that, I already know what's going on. Okay? Even if the tear has been repaired. And you always want to watch the good knee, because those animals will chronically always bear a little bit more weight on this animal. So that your healthy knee is going to receive a little bit more weight, more stress to it. And often the dog that ruptures one knee is going to rupture a knee. It's just a matter of when. Okay? So all of this, I have yet to adjust and work at this spine, but this is giving me a lot of information. So then the next thing I do is I just rub my hand down his body, and areas that are uncomfortable, he will, that I'd either feel a lot of heat in those areas, and sometimes people, when I say that, like, you can't feel heat, and then I have them feel it, and they're like, oh, wow, that does in fact feel hotter than the other parts. You can feel it through a heavy-coated animal. Yep. Cats are, of course, a little. Everything that I'm doing here, I can't really ask a cat to do, just because I have a limited amount of time. So I generally just go to this part right here with the cat, okay? And in Pudge, in his case, he's just a little bit warmer right here. You're welcome. He's a little bit warmer right here, the rest of the spine. So warmth to me means we have an increase in blood flow, which means that there's something going on with the muscles, which in turn means something's going on with the movement. Okay? So then I go, this is the part where I literally go down his whole back, and I find the parts of his back that are uncomfortable. Let me see if he'll do this. Okay, so that part where I said he had heat, you see that? He's uncomfortable right there. Okay? That's the other thing that I look for. And some animals, just doing that action will give you that, assuming that we don't have an itchy hair coat. Yeah, that's muscles, like, please stop doing that. Okay? Which is why I'm not going to keep on doing it for him. But okay. And now I go down joint by joint, and I feel his back. An animal, once they figure out what you're doing to them, they actually like it. So the first few times I lay my hands on them, they're like, lady, what are you doing? I don't like this. After that, halfway till we get about here, they're like, oh, this feels fantastic. And they'll just stay there. Some dogs with an adjustment, same thing with a cat with an adjustment. They will either yawn, lick their lips, and if it's a really good adjustment, they'll shake their whole body. Sometimes they'll actually look back at you and say thank you, in a way. If they're painful as I'm doing this, I'm going to expect them to bite, but I generally try to not. If an animal's that painful that it's going to bite in just touching, I generally say, go home, let's get them a little bit feeling better before we even try this. Because what I don't want to do is have to wrestle an animal through muscle that's spasming and try to do an adjustment then. Okay? So now I go down his whole back. I'm just motioning right now, trying to feel what this joint is telling me.
You don't get the same pop and crack that you do.
Yeah, you don't.
With people. So.
You never want to ever hear that in an animal, okay? You're not going to hear those pops and cracks. All of those come out from me, not from them. But right here, for instance, this hip isn't moving as well. It's stuck up here. So I'm just going to go stabilize him a little bit. Go ahead. Okay. And that was one adjustment right there. And depends. Huh?
He's had a mini adjustment. He's never really been he's never had a full adjustment like top to bottom, just because he's never really, I'm not an awesome owner. Yeah, so it should be done preemptively for him because I know he's got bad conformation of his hips, but he's only ever had it done.
I apologize to give you my back, but I have to just check. Yes and no. So some parts of it are, and like the upper neck issue, he's kind of comfortable with that. It's this back hip part that he's not ever had. And I literally am finding the vertebrae, and I move this vertebrae in every direction, and this vertebrae is stuck this way. So you have to go back and adjust it there.
His eyes are halfway closing when she's doing that, and some will actually fall asleep.
I have one dog that you just say, okay, get ready, and he goes to sleep. And I'm like, okay, good. We're getting to that little tender part. We're a little off on this side, so. For every adjustment I do, I also try to feel it after the adjustment. Make sure, okay, now it's moving like it should. So he said to me, hey, lady, what are you doing there? And he just looked right back at me. I adjusted him there, but he wasn't very fond of that one. Yeah. Let's work on his neck a little bit.
You got that for me?
Okay. This one's a scary one for some dogs because we have to hold their neck still, and then I'm all up in front of them. And so once you tell them to relax a little bit, they'll understand. And this one, I'm literally looking at, I didn't adjust him, but I'm looking at the movement of the skull on this upper vertebra. It should move equally from side to side. If I'm finding a spot where this is what I'm getting, I'll go ahead and try to get it to move better. So he moves nicely this way, now moving as well the other way. I'll go ahead and adjust. Okay.
He's also very sensitive about his ears, so the shaking of his head is just a him thing.
Good job, love. Can I finish the rest, please?
Yeah.
Let me go finish. This is another part where some animals kind of get a little bit nervous because I have to hold on to them like this. And a dog with really bad neck problems, you don't even want to try this. Because the moment you just lay hands here, they're going to start yelling, they're going to try to bite. So that's when you say, let's feel a little bit better, come back in, and we'll try it again. No. I'm asking a lot of you, love. All right. Let's turn you around, Pudge, so I don't face everyone with my back end.
Thank you.
And I will show you something if you can do your processing. Just come through.
Here's another spot. And this is his troublesome side. Okay. So you can adjust their legs too. And this is one that I generally have people do at home because it's very easy. You can't hurt them, you can't break them, and they'll appreciate it. Feet towards me, Pudge.
That's not right. Come back up. Up.
Up.
Good boy.
Sit. Thank you. Okay, we'll do it this way. This is the chiropractic version of cracking your knuckles. It's okay to do. You don't want to do it more than every 2 weeks. But you'll be surprised that dogs' feet get the same things we do. If anyone's ever had a toe cramp where you're walking and your toe just is forever stuck and you've had that pain in your big toe, you know how painful it is, and that is what can happen to some dogs. So essentially, this is what you're going to do. You're going to start off close, and you're going to circle and pull out at the same time. Okay? And if your dog's toes are actually stuck, you'll feel them almost pop underneath your fingers. You won't hear it, but you'll feel it. Yes, you can.
If they let you.
Yes, you can. All of this you can do to a kitty cat, and I have a couple of kitty cats that I see, but you got to get down to business with them. And once, like I said, once they know what you're doing, they're like, okay, this is fine. And some of them are actually, you can see it, that their level of stress, because cats get very stressed when they go to the hospital. Do you actually see their level of stress go down? Because now they associate the hospital with something good, right? Because you always make me feel better after I get this, as opposed to you always poke me with the needle. And then the other thing you do is you're going to almost scissor these right here. You don't realize how much movement there is in these bones until you actually do it yourself. Okay? And you're going to do that same motion. Hi, I'm sorry. That was very rude of me. I didn't ask you for your foot. And I apologize.
I'm sorry. I'll stop patting your chest. You have to sneeze, don't you?
He has to sneeze, and he's trying to hold it in. But you can do that to your own pet, okay? And the wrist is something else that you can do. I generally like to put 3 fingers in between, and I'd like to curl the paw around my fingers slightly. All right? And this is the wrist equivalent of cracking your knuckles. All right? And that in itself can sometimes help them feel better. Yes. Yeah. There's a lot of dogs that I get nervous with when I see them the first time because they're so all over the place that I'm like, I'm going to be sweating by the end of this. But once they start realizing what you're doing, they're actually like, okay, I like this. This is fine. There's probably going to be some running around going on, but probably not as much as them being extremely energetic.
Generally, when we do the adjustments on their side, they lay like this. So it's a little more of a control. They mellow a bit.
Any more questions about adjustments or anything in today's lecture? Aging dogs. I think it's a great form of pain relief for them. By the time they get to be, you can share this with me. Yeah, see?
Yeah, he sits well when he thinks there's a treat involved or when it's six man. But the minute he sits for comfort, this is how he sits.
By the time they get to be 12 years old, what happens is there's a lot of arthritis that settles in, and that's often the time where we do pain control, whether it's arnica or devil's claw or Duramax, Medicam, or something else. Those take an effect on your other organ systems, your liver and your kidney. We also recommend that they're on glucosamine, chondroitin, and fish oil. And we even say start it when they're young, because the truth is an animal that's on those since they're young actually requires less pain medications when they get older. Glucosamine, chondroitin, and fish oil. Glucosamine and chondroitin often come in one, and then the fish oil is a separate thing. You can give human people fish oil. Cats is a little bit harder because the dose is extremely high. So then probably not. Don't go there then. Don't. But glucosamine and chondroitin you can do. All right. But in a 12-year-old dog, I think it's great because those dogs, you can go from an every single day administration of pain medication to half the dose every single day. And there's some dogs where they come in. My favorite is when they come in and it's like I can barely get them to stand. And then I do a couple of adjustments on them. And then they're like, hey, let's go home. And they're standing up and walking. And that's the favorite for me. And sometimes you don't see that immediately. Sometimes I say, give it 24 hours. Because some dogs, just what I did, that takes a lot out of them. It doesn't look like I'm doing much, but they're feeling a whole lot of input in there. So some dogs will sleep it for 24 hours. And they are ready to go. And they do stuff. I adjust older dog.
What are you doing?
She's like, stop.